Hello, good day, my friends, maybe families, and my CFC couples for Christ who are right now joining me for this episode of safety and risk and prevention. Our topic for today would be cancer. So it's the big C. Maybe a lot of people would like to hear how to prevent ourselves from getting the big C. And we can do it naturally. Of course, there's no guarantee in life, but at least it will help us find some ways to prevent these cancers. Okay, are you ready? I want to share this information to you. Okay, the first thing that we have to see is the five foods to skip after 50. In fact, this is not even good even if you are less than 50 years old, because this will not do good in our bodies. You know, they're good, tasty, but not good for the body. But a lot of people don't know that. So, and I don't have to describe them, they describe themselves by the picture. And as you can see, this is a guy who it looks like he's doing something. Oh, he's doing, is that selfie? Or, I'm not sure. But anyway, he's happy and he's in the middle age. Okay, so how do we prevent cancer? Okay, so most of these things, for example, our age, when we are aging, and genetics, we cannot really avoid that. But fortunately, the genes for cancer or cancer forming genes are only responsible for about 5 to 10% of cancers. So, but most of the cancers, more than 80% of the cancers, are there or here already in our body. And I think I already discussed that. They are precancers or procancers. And if we don't do the right thing, we can probably not avoid for them to grow in our body. For example, how do we avoid that? Aim for 300 minutes of moderate intensity physical activity. This is good for everything, good for the heart, good for the brain, and good to prevent cancer. Why? Because we know that physical activity can increase our immune system, and our immune system is the one responsible to kill the pro-cancerous cells in our body. So that's really good. Number two is to avoid alcohol. We know that alcohol is a chemical and also a drug that if we do that on a regular basis, it can burn our esophagus, it can burn our throat. We can have cancers in those areas or oral cancers. And also, of course, liver cirrhosis in the long run. And remember, we're just doing some cancer discussion at this time. And then limit or avoid red and processed meats. What are the red and processed meats? We already know. Those that come from cows are red meats. If we want some meat, chicken and turkey would be good because they're less fatty. And we know that trans fat's not good for us. And that is also a cancer promoting food. And then, of course, the processed meats, for example, bacon, which is really good, sausages, which is really good, those processed hams, and the other meat, because of the preservatives and the high sodium, which is not good. So, all right, maintain a healthy body weight. It's up there, but yeah. Yeah, maintain a healthy body weight, because obesity is a risk factor for cancer. All right, obesity is a risk factor for many, many cancers like colon cancer, for women, breast cancer. They've already seen that, and also other gynecological cancers. adopt a healthy eating pattern. I mean, if you want to eat healthy. We know that we've already seen a lot of videos about plant-based food, and I will also show you in a little while some real good food. There are 13 foods that are anti-cancer. Cut on sugar sweetened beverages. We already know about the sugar. Limit sedentary behavior because we know that exercise is good. So if you're not exercising, then we are prone to cancer. And of course, don't smoke because cigarettes, 75% of cigarette smokers can get lung cancer and some other cancers such as oral cancer, the cancer of the throat, the larynx, so many head and neck cancers for smoking. So we don't want that. We already discussed about the sedentary behavior and stay on top of cancer screenings. Unfortunately, we only have a few of cancer screenings, but many cancers don't have any screenings yet. But fortunately, the most common cancers, we have some screenings that we can do. And of course, advocate for community action. This is for people with cancers because they're prone to depression, or people who are a high risk for cancers, like those who always drink alcohol. There's Alcoholic Anonymous. If you cannot take it away, the habit. And also there is smoking cessation. In America, usually it doesn't work because they know that it's not an illegal thing, and that they'll probably cross the bridge when they get there. So, but for people who are really very smart about their health, this is something that you may want to know. Now, this is for cancer of the skin, especially those who are very fair and they don't have a lot of melanin pigment. So if you want to get your vitamin D, get in the sun before 10 o'clock a.m. Or after 4 o'clock p.m., but not in between because of the high dose of UV light. Okay, so stay in shade, cover exposed areas. If you want to be running, don't run half naked, just like what I'm seeing in a lot of kids nowadays, no? And sunscreen must be applied every 2 hours. So don't be, you know, because if you don't apply enough, you don't apply every 2 hours, then it's nothing. And then get vaccinated. There are cancers that can be prevented by vaccination. For example, hepatitis B. Hepatitis B can be spread through sexual intercourse, through using needles, contaminated needles, through contaminated blood, stuff like that. So there is already a vaccination for that. This is the only primary cancer of the liver that can be avoided through vaccination. The other one is the HPV, which is for cervical cancer. So if you really want not to have cervical cancer, 99% of cervical cancer is caused by human papilloma virus. So there's already a vaccination for this, and this is also 2-dose vaccination for this. And even the males are vaccinated if they find out that the female partner is positive for HPV, then the male partner can be a carrier and needs to be vaccinated as well. So what are the 10 commandments for cancer prevention? I'm just going to really go fast on this food because you already know, but these are anti-cancer foods. Beans, fish, fatty fish, because we're not going to elaborate on this. As long as you know that these are the food that you need to fight cancer: broccoli, olive oil, carrots, Berries, cinnamon, it's also anti-cancer. Of course, nuts are anti-cancers. Turmeric, anti-inflammatory and anti-cancer as well. Flaxseed has a lot of omega-3 fatty acid, which is anti-inflammation. By the way, inflammation, chronic inflammation or chronic inflammatory diseases can also be a risk factor for cancer. Citrus fruits is good, especially for um, cancers of the throat. Tomatoes, garlic, very, very good, not just for cancer, but also for blood pressure problems. And then these are the food. Okay. I just want to let you know that 11% mortality rate if we detect the cancer early enough. It doesn't mean cure, but at least, you may not undergo chemotherapy, or you may undergo chemotherapy and remission. But if we don't get it on the early stages, 79% mortality. All right. And 71% of cancer deaths are caused by cancers without recommended screening. I already told you that there are only a few cancers with recommended screening. So the others are found when it's already too late. So these are the screenings. Let's just go to the 50 and above, because most of the audience are 50 and above. So breast cancer screening with mammogram, cervical cancer screening through pap smear, colorectal cancer screening through colonoscopy, and then lung cancer screening for those who have risk factors such as male 60 years old and above and a heavy smoker. But otherwise, they don't really screen for lung cancer for people who are not at risk. Discussing prostate cancer screen with a doctor recommended. There are lots of controversy about prostate cancer screen, although we still do the PSA level with our patients. Okay? So please don't help cancer grow. Okay, these are just common questions that, if you don't mind, we can go through it, and I can give you, the direct answer. For example, how does or who gets cancer? Anyone can get cancer. Depends on what cancer it is. Sometimes it's genetic, but it's only 5 to 10%, but the rest of it is sporadic cancer. How does cancer start? I've already told you, we have oncogenes, and then sometimes the DNA of our cells mutate, and they get errors depending on how they mutate. And then whenever you are exposed to the right environment, then the cancer develops. Is cancer genetic? We've already answered that. Some of the cancers may have genetic predisposition, like we have 5 to 10% of breast cancer could be genetic. Maybe 10 to 20% of colon cancer could be genetic, but the rest are sporadic. Is cancer contagious? No, cancer is not contagious, but if you have HPV that can cause cervical cancer, of course, it's contagious to the partner. Is there a vaccine for cancer? We already answered that. Hepatitis B and HPV vaccine. Can cancer be cured? To me, or for me, cancer cannot be cured, but if it's detected early, we can do something about it. You can be treated, and then you are followed in 5 years. If in 5 years you don't have recurrence of cancer, then you are considered in remission. But I haven't really heard that it's cured unless it doesn't come back. What are the stages of cancer? That depends on what cancer it is. Does cancer have symptoms? Yes. So these are the symptoms of cancer, just in case that you did not get screened. If you have changes in bowel or bladder habits, what are the changes? For example, if you are regular and then you became all of a sudden constipated, or you cannot go to the bathroom, that means there could be a tumor blocking. Sometimes also you have a pencil size stool, which is a new thing. Sometimes you may have rectal bleed. Those are the changes that you should be aware. And then sore that does not heal unless you pick the scabs. That does not conform with that. So if you have a sore and whatever you do, it does not heal, then it could be cancer. Unusual bleeding or discharge. This is usually in the vagina. Um, for example, you're 50 and above, you're postmenopausal, and you never had any more bleeding, and all of a sudden you have bleeding, then that could be, and if you still have your uterus, then that could be a form of endometrial cancer. Thickening or lump on the breast. And if you don't know how to do a breast exam, in fact, they say that it's only 50% accurate. So mammogram is still the standard screening of choice. Indigestion or difficulty swallowing for those who always drink or who are smokers, or people with gastroesophageal reflux, where you have a continuous flow of acid in the esophagus that can damage the esophagus and will develop cancer. Obvious change in a wart or a mole, we know that could be melanoma, especially for those who are very fair. Nagging nagging cough or hoarseness. Sometimes it's just like a dry cough or whatever. It could be other stuff. It could be allergies. It could be gastroesophageal reflux. But if you're not sure, especially when you're a smoker, you have to go to the doctor and get image, because that could be lung cancer. And I have two patients who had lung cancer who just came to me with coughing. And once I did the CAT scan, lo and behold, one has a big cancer, the other one, the cancer it has already spread because he has other issues rather than that, or other than that. Okay, and this is just how to prevent cancer, to find it early. They say at least 75 to 80% of cancers in the United States may be prevented by lifestyle changes. We've already talked about that. Okay, and these are the cancer causing foods. We've already talked about that. So this is the end of our presentation, and the still best thing for cancer is prevention. And there are lots of articles about it. I just put them together so I can present it to you in a way that you can learn a little bit from it. And you know, we only have one life. Our body is ours. We've been created by God. We have to love our bodies, and in order not to get into trouble, we have lots of things that we can do, and they are all yours to review. And I hope that you have gotten some stuff from whatever I have told you today. I did not use Tagalog words because I heard some comments that it's better spoken in English, because all my slides are in English, and at the same token, Filipino people do understand English as well. So I think in order for the other people to benefit on this, then I started just saying it in English. It's good I did not have any nosebleed, but I thank you very much for listening.